You may have seen in the news this week that Justin Bieber has been diagnosed with a condition called Ramsay Hunt Syndrome. It's a form of facial paralysis, and obviously for him as a performer, that is a big deal, and he's had to draw back on some of his concerts and some of the things that he got planned and so on and so forth. And immediately when somebody in the public eye like that is diagnosed with what is not the most common of conditions, it makes people go, well, what is this all about? And shines a light into the often isolating and distancing struggles that people have when they are living with an ongoing condition that very few people understand. So, as is our wont here on Talking Point, we thought we would take this opportunity just to look a little closer at the issue of facial paralysis, the conditions that cause it, and the impact that it has on people's lives. Joining me to talk about it is Catriona Neville. Catriona is a specialist physio, and she's also the chair of Facial Therapy Specialists International. She's also a part of the charity Facial Palsy UK and part of their medical advisory board. And it's fair to say, Catriona, that there are many different conditions that can cause some form of facial paralysis, isn't it?
That's right. Thank you so much for inviting me on to talk about this. As you say, it's so important to shine a light on a condition like this that so many people suffer in silence with. There are indeed many causes of facial palsy. Facial palsy is more of an umbrella term that covers all the different diagnoses. So the most common diagnosis is Bells Palsy, and Ramsay Hunt Syndrome is the second most common cause of facial palsy in the UK. And there's about 100,000 people in the UK living with facial palsy, so it's a significant number of people, although it's quite a rare condition.
Now, this is the point at which I step out onto the thin ice of my lack of knowledge, and you immediately put me right. But my understanding is that the palsy, the paralysis, the way in which the face doesn't work properly is caused by the impact of a condition on the nerves and the muscles of the face. Is that right? And what is the effect that it causes?
That is absolutely right. So don't worry, you've got that correct. So it's Ramsay Hunt Syndrome in particular is actually caused by the varicella zoster virus, which is the same virus as chickenpox or shingles. And that causes swelling in the facial nerve near where the ear is. And that swelling puts so much pressure on the nerve that the signal can no longer get through to the facial muscles. So the muscles become paralyzed. So patients have this paralysis of half the face. And the difference with Ramsay Hunt Syndrome is that alongside that facial paralysis, patients can also have severe pain in their face or their ear or their head. They can have a rash or blisters in their ear, their face or their mouth. They might be dizzy, suffer with vertigo, have reduced hearing, and potentially have tinnitus as well. So a whole raft of symptoms that can help differentially diagnose Ramsay Hunt Syndrome compared to the more common Bell's palsy. And what's really important with these different symptoms is that people with Ramsay Hunt Syndrome need slightly different management. So everybody who gets a facial palsy should be investigated to make sure there's nothing more severe going on underneath. That needs to be ruled out. But everyone should also get steroids within the first 72 hours. That's really critical. But with Ramsay Hunt Syndrome, these patients need antiviral medication as well in the first 72 hours. And sadly, when we've done surveys and studies with the Facial Palsy UK charity, we've found that over 50% of people are misdiagnosed. So they're not getting that critical medication. And what that means is they have less of a chance of making a full recovery. So 70% of people with Ramsay Hunt Syndrome will make a full recovery if they've had the correct medication, the steroids and the antivirals. But the remaining 30% sadly won't make a full recovery. And if patients haven't had that medication, their chance of recovery drops to 50%. So that's really significant. Really significant. And of course, when you have half your face paralyzed, you can't close your eyes. So your eye is really at risk of damage and being very, very dry. So these patients need urgent eye care at the time of diagnosis as well. And then there's this common misconception that when you're injured, you should exercise to try and get better. And in fact, Justin Bieber himself said, I'm doing my exercises. And actually what we know as specialists is this is the time you need to rest and recover. You mustn't exercise in these early days. Otherwise, you can actually make the problem worse long term. So it's getting that correct information out to people that is so vital. And that's where Facial Palsy UK comes in with their fantastic information sharing, and their website information is unbelievable on this subject.
Well, if you're impacted by this, you can find, or somebody you know is, you can find all that information by going to facialpalsy.org.uk. That's facialpalsy.org.uk. And as you say, there are different symptoms for different forms of condition, but the outworking of it, if we for a moment laid to one side the pain and so on, the outworking of it, of the practicalities of some or like half of your face being paralyzed and you not being able to function properly, that must have an incredible impact on people's ability to live, to work, to engage socially.
Absolutely. I mean, our face is the way we communicate. I actually call facial palsy a communication disorder because it really impacts on the way people can communicate with each other. And yes, if you think about work, about relationships, even kissing your partner becomes difficult when half your face is paralyzed. We've got parents, mums who get facial paralysis in pregnancy who then can't smile at their babies, and their babies actually learn to smile with half a smile. This is such an important thing for people to understand. And as I mentioned earlier, there's that cohort of patients who don't make a full recovery as well. And they actually continue to have a lack of facial movement long term, caused by muscle tightness and stiffness, where the face hasn't learnt to move properly again, the nerves have rewired incorrectly, and these people are going to have long-term pain, long-term difficulties with closing their eye, with eating, with drinking, with speaking to people, and of course the impact on their psychological health can be extreme. So we always say to people, you know, if you're not bouncing back and recovering from this, it's so important to get specialist help from specialist facial therapists, specialist counsellors who can help with the trauma of undergoing such a sudden and debilitating condition. We can offer in the NHS botulinum toxin for people who have this ongoing overactivity in their facial muscles and pain, and that can really help improve their symmetry, improve their comfort. And also in rare cases, people can have surgery to actually reduce the overactivity in their facial muscles. So there's a lot that can be done to help people if they get to the right specialist centres for help.
And that sometimes, as you say, I've already said, that sometimes is the very difficulty that people have, because it is misdiagnosed, because there isn't perhaps it's not at the front of a GP's mind when they're looking at someone. They're thinking about, I suppose they're thinking about things like strokes and things like that, rather than the possibility of some sort of facial palsy.
Absolutely. And because GPs perhaps don't understand the implications thoroughly, even specialists don't understand facial palsy, because it's such a niche area of specialism, all too often my patients are told, oh, well, if it's not better within sort of 12 weeks, you're just going to have to live with it. And that must be awful to be told that. And actually there are things that can be done to help. And that's where if people contact the Facial Palsy UK charity, they can put them in touch. There's a handful of specialist centres in the UK and internationally. There's not many of us around, but those of us who are there, you know, our pure function in life is to help people with this debilitating condition. So if people contact Facial Palsy UK, they can find out which specialist centre is closest to them and get referred there and get the help they need. And of course, every patient in the UK has the right to request a referral to whichever centre they would like to be referred to.
And that website again is facialpalsy.org.uk, facialpalsy.org.uk. There's an awful lot there about the different conditions that can impact somebody's life in this way, about the symptoms and so on. But if we were to, given what you've just said about the difficulty of diagnosis and sometimes the misdiagnosis that happens, if we were to identify one or two trigger points that would make you as a professional familiar go, this needs to be followed up, what would you advise us to be aware of, in the same way that we've been advised to be aware of things like strokes and the symptoms that can identify them?
Absolutely. So anybody with the onset of facial palsy, be it a fast onset or a slow onset, should be seeking medical attention. As I said, they need to get that medication within the first 72 hours. So that's the first critical point. And then if they're not bouncing back and making a swift recovery, they should be seeking specialist help. So if you have a facial paralysis, please go to your GP, to A&E, get the medication you need within the first 72 hours. And then if you haven't made a full recovery by 6 to 8 weeks, start thinking about finding a centre for specialist care where you can get all the advice and information that you need, led by someone who specialises in this tricky area.
As Catriona said, it's not the most common condition for people to experience, but facial palsy does affect a significant number. We are talking 100,000 people here in the UK at the moment. That is a significant number of people who can be impacted. It may well be that somebody near you is impacted by it in the future. It may well be that you are impacted with it in the future. The important thing to do is to get it treated and to get help as soon as possible. And as so many people are talking about it at the moment, if you want reliable information about this, facialpalsy.org.uk is the website to go to. Catriona Neville is from Facial Palsy UK. She's also a specialist physio. And thank you for joining us and unpacking this condition for us this morning. Thank you, Catriona.
Thank you so much for having me on. Thank you.